hopefully you didn't get sleeted on too much out there. And it is sweater weather now, so make sure to break out those sweaters. All right, so we have a pretty full agenda today, so I want to make sure we have enough time to get to all the topics that we have to discuss. But first on the agenda is approval of the minutes from last meeting. Anybody move to approve?
I have a question. Is Ian in the audience?
Ian
Is there a representative from the city? Legal staff?
Are you saying city attorneys? No.
There is none? There's a reference in the minutes that the city commission does not approve the Board of Health bylaws. Does that mean that they're really non-existent?
We cover that in the updates.
Yep, we're gonna cover that in the
Okay.
bylaws update.
All right, thank you. That's the only thing I had
Okay.
about the minutes.
I'll make a motion to approve.
A second.
Thank you. All those in favor signify by aye.
Aye.
Any opposed? All right, thank you. Desi, department updates is next.
Yeah, I just wanted to do a couple little updates just to let you know where we're at. We did restart our all-staff meetings, which we haven't had an all-staff meeting for almost 3 years because of COVID and our other responsibilities. So we were able to have one and do some of our strategic planning updates, and it was just a really good time for our staff to get together and reconnect. We had a whole wall of pictures of new staff that we've had since January of 2020. We caught up on recognition awards, and so it was just a really healthy time for all of our staff, which was great. Also wanted to let you know that our program numbers have started to rebound much quicker than we actually thought they would. As you're aware, during the pandemic, we had to shift staff and we had to put some restrictions in place for our programming. And so that impacted our numbers a little bit, and those have all, our family planning numbers are starting to go up, our WIC numbers, and our nursing programs also. So that's been really encouraging to see that is coming back quickly. Then just wanted to remind everybody, obviously we're getting into flu season, and so that seasonal flu vaccine is super important for all of us, as well as the bivalent COVID booster is also out and available. So encourage everyone to look into those options to stay as healthy as you can this season. And then just wanted to give an update on the home test kits that we have been distributing in the community and to businesses. We have currently distributed 132,000 test kits. So kudos to our EPR staff that has been involved in that effort. That is all I have.
Excellent. Thanks, Desi. One of the things that I wanted just to mention, just if I can slide something in here, is it's October. Gladys Ray is looking for socks this month, so I'd just like to challenge each of my fellow board members to contribute to that and to get some new socks to Gladys Ray. That's important initiatives. I saw that on social media, so just encourage you all to contribute to that. All right, the next thing on the agenda is the bylaws update. And so as many of you know, we have a subcommittee was formed to look at the bylaws, and we were reviewing that. We reviewed that last meeting that we had, and we have since received clarification that that's really, many of the changes we are proposing are under the authority of the Fargo City Commission. And so that is going to go to City Commission to review those changes and take action on that piece. So we're not going to take any action on that today. They're going to review the changes and address it from that standpoint. Any questions related to that?
What are you going to report to the city commission?
So they have our proposed changes.
Well, have we approved the proposed changes, this board? I don't think so.
So I think what happened is the city attorney gave an opinion that The membership and the responsibilities and the mission are all under city commission authority. And so they are the ones that would have to make or suggest any changes to those bylaws that are tied to ordinance. So the Board of Health would be responsible for any just process kind of bylaws about the schedule, about, what they expect members to show up and participate, that type of thing. All the other ones are under the authority of the city commission. So that is being referred to them.
At the present time, I'm not prepared to support any effort by this board to request of the Fargo City Commission anything. I think it's inappropriate.
I think we identified that, I don't know, Desi, if you can help, the process in the ordinance of any board member needing to be appointed and approved through the city commission, and that hasn't happened throughout a few of the appointments. So I think there is a need for that to be looked at, and which is what was the city attorney's recommendation.
Yeah, so it really isn't, this board is not making any decisions based on the bylaws, and it's not really for, it's up to the city administration because the Board of Health is a city group. And so they have the authority to decide to look at bylaws and to look at those things that they can make changes on. So that's why this group is not taking up any of those discussions.
So any recommendations that we had to the bylaws are not current, they're no longer in place. Any recommendations or review that we had.
Correct.
Correct.
So to be clear, the board is not sending anything to the city regarding any bylaws at all?
We are not sending any formal recommendations. If that's
Any
the question.
recommendations, requests, or anything like that?
Nope. Obviously, the proposed changes that we made or that we were looking at last time is public record, but that's not a formal recommendation to them. They have it for background of what we were discussing, but it's not something that went to them as a formal approval.
Okay, but when we say that we were discussing, who's the we here? Because there was no discussion at the last meeting, so I'm just curious.
Well, we did review the bylaws. We had the side-by-side comparison, and we did have some discussion, but, that was all matter of public record too, so.
Okay.
If I can also add to that, actually, the attorney is recommending some changes, so it is on the agenda on Monday evening. Again, at the
I'm sorry.
city commission level,
I'm sorry, it's on the agenda of, I didn't hear that
on
last.
Monday evening,
Oh, for the city,
for
okay.
the city commission.
Right.
Again, the recommendation is not coming from here. It's
Okay.
coming from, it's being borne by and will be approved by the city commission.
Do we have access to that recommendation?
The agenda is public, yes. It's on the website.
Any further questions? Okay. Dr. Newman, health officer update.
Hello, thanks for having me. I know we have a really packed agenda, so I'll try and be brief. I was just going to update you guys on a few things I'm following, provided I can understand the technology here. We'll do it like that. Okay, so first, just a brief monkeypox update. I come with good news for once. Worldwide, our monkeypox cases are decreasing. The World Health Organization reported recently a 22% decline in cases globally. To date, we've had 105 countries report 62,000, probably more than that now, confirmed cases with a total of 23 deaths. And then here in the United States, as you may recall, the United States and Europe had the highest rates for a number of weeks. The CDC has reported our total of 24,364 cases, and we are now for the first time seeing our cases drop nationwide. In North Dakota, we've continued to only see 6 total cases. The majority of those have been here in the eastern part of the state. We've had 1 out west, and cases still predominantly involve young adult men. So because of this, many public health agencies are actually downgrading the classification of this disease. It was previously what we call a Category 4, but now because we have access to vaccines, treatments, and really just a broader understanding of how this is spread and ways we can do that in the community, it's been downgraded now to a hazard group 3 organism. So others that we think of in this category are things like salmonella, HIV, Hep B and C, tuberculosis. So all diseases that are managed at the community level. And then briefly, just looking ahead to flu season. In fact, I think we're already there. Unfortunately, an unusually severe flu season is predicted for this year. Many public health experts are warning of potentially more severe disease. There's 2 main reasons for this. One, the COVID-19 and pandemic restrictions that we were all taking with social distancing, avoiding large gatherings, maskings, etc. That's all been lifted now. And it's also believed that we have lower population level immunity just due to fewer people actually getting the virus or even getting the flu vaccine over the past 2 years. So that really sets us up to have a more severe season this year. Fortunately, the twindemic that people had been worried previously about, where we would see both flu and coronavirus at the same time, is unlikely to occur this year. And certainly southern hemisphere countries where it's currently winter, so places like Australia and others, they are seeing very tough flu seasons with case rates peaking earlier than usual. In fact, Australia is reporting its worst flu season in 5 years. So as Desi said, October is a great time to get both your bivalent COVID-19 vaccine and your flu vaccine. And since I made these slides, actually the CDC has come out with their weekly flu activity report, and they are reporting increasing flu activity pretty rapidly in the United States. So we're seeing influenza and what they call influenza-like illnesses rising, and the rates are much higher than normal for this time of year, particularly in the southeast and central parts of the United States. And of note, they're seeing both adult and pediatric cases this early, which is a little unusual. Typically during influenza seasons, you kind of see the rapid rise of cases in December, and we usually peak in February. So October would be much earlier than we're used to. A school district in San Diego this past week actually reported hundreds of absences due to an influenza outbreak. So we're also seeing earlier than expected rise in other viruses. In pediatrics, we're seeing a lot of RSV, which is a little atypical this early, and things like rhinovirus and enterovirus. So again, everyone over the age of 6 months and older is recommended to get an annual flu vaccine. And I just want to remind people that it takes your body about 2 weeks to fully establish protection after you get your flu vaccine. So the earlier, the better. This year, anyway. And then a little update about COVID vaccines. As you guys know, the bivalent COVID booster has been available for people aged 12 and older. And then actually this is outdated even from last week. So as of 2 days ago on October 12th, the CDC and FDA granted emergency use authorization for both Pfizer and Moderna boosters, bivalent boosters in the younger age group. So Pfizer's for kids age 5 to 11, and Moderna's for ages 6 to 17. So the previous monovalent boosters that we were using will be completely phased out and not available anymore, and only this bivalent booster will be available. So just to remind you what that is, the original COVID vaccine we were using was the original SARS-CoV-2 virus, right? The Wuhan virus that we saw. The bivalent has both that original virus plus 2 Omicron variants, BA4 and BA5, which is predominantly what we see right now when we sequence them. It's all Omicron. So good news that our kids aged to down 5 years can be receiving that. And trials are ongoing for children all the way down to age 6 months. It's anticipated that Moderna and potentially other companies will seek emergency use by the end of the year for children that young. And then I'll just end on how we're doing in North Dakota on our COVID-19 vaccine rates. Still a lot of work to do here. This was actually an older screen grab. They've updated it since I did this, but it's sadly not that changed. You can see at least one dose of all citizens 6 months and older. We're at about 55%. I just wanted to point out, it may be hard to see here, but our pediatric rates, at least like for the statewide, so North Dakota total, this blue line is 5 years and under. We're only at about 6.6% of kids having had one dose. For 5 to 11 years, we're at about 23.9. Those numbers are a little better in Cass County when you switch this. One dose for 5 and under is about 13%, and actually that 5 to 11 year range, we're about 38%. So with that, I'm happy to take any questions. Or I'll tee up the budget report. Much more exciting. Thank you. Or does anyone have any questions? Sorry. Yes, name off.
I do. So I. Huh? Is it off? There you go.
It's on now.
Okay.
It's on.
Thank you. I have a couple questions on the monkeypox parts.
Yes.
You know, just like COVID-19, there are asymptomatic individuals. So what role are asymptomatics and the monkeypox individual play in transmissions? Have you?
Yeah, it's a good question. To my understanding, very little. While monkeypox cases can be clinically mild and maybe only have fever, rash, whatever, there's usually not asymptomatic. They usually will present, particularly the ones that are presenting to test. And there have been cases of people needed to come into the hospital and, like I'm saying, deaths, but usually not. It's not as much as we saw with things like coronavirus.
Okay, thank you.
Yeah.
And then also on Moderna part, since it's been approved now for a booster, is it for booster, correct? So
Yes.
Are there any side effects that we should be expected from those?
For the pediatric population?
Yeah.
None more than with the original vaccine. I mean, I would say in this younger age group, the 5 to 11, it's actually a lower dose. So it's only a 10 microgram dose, at least for Pfizer. The Moderna one is younger in the younger age group as well. So anecdotally, as a provider in our community, I don't see a lot of side effects in this age range. The 12 and older receive the adult level dose, so sometimes they do. Some of my adolescents experience things like fatigue or headache or things like that. I feel like in this age, it's mostly just sore arm or anxiety around needles, as with any shots, but I don't see a ton of side effects.
Thank you.
Yes, absolutely. And if you're speaking of myocarditis, which is the one people worry about, in the clinical trials of these younger ages, there was 0 cases for both.
Wonderful.
Doesn't mean once we get out to millions and millions of people, you won't see that, but they didn't in the clinical trials.
Sounds good. Thank you.
Questions? Anyone else? Go ahead.
On the COVID matter, what percentage can you tell us are infected but are asymptomatic?
Here in North Dakota? Or
Yes.
I don't know that we would.
Do we have any data on that?
I'm unaware of that. I think one of the issues we're facing right now at the health department is people testing at home and not reporting their numbers. So I feel like we're struggling with data in general. We're only getting cases of people who are sick enough to go and test and be reported.
The reason I ask is that my understanding in some of the things that I've read is that there's a substantial portion of people who are infected but are asymptomatic.
Yes, I would say that's true, particularly in the pediatric population. They usually experience very minimal to sometimes no symptoms.
Thank you.
Yeah.
Just to add to that too, the mayor reminded me, you know, we do have the wastewater reporting as well. So that kind of helps us track a little bit of what levels are like in our community. But it is really difficult right now to capture the true picture of how many are testing positive but staying at home, and that doesn't get reported and captured in any numbers. So the numbers that are reported are obviously grossly underestimated.
Thank you.
I would liken that issue to influenza too, right? So that's highly underreported because folks have that at home and don't necessarily go in for that, so. Okay. Any other questions? I appreciate the information on influenza. I'm sure we'll continue to hear about influenza as the flu season ramps up, so thank you, Dr. Newman.
Of course, thanks for having me.
Great, budget update.
Hello. So we're through the end of September, and in both cases, revenues and expenditures, you see the expenditures in front of you right now. They're about 83 to 85%. Through September should be about 75%. And in both cases, it's due to our budget probably not being very accurate. So we're missing numbers on the revenue side and on the expense side. The budgets were done, of course, quite a long time before the year started. So we have under budgeted in some of the areas. And I'm just gonna go through a few things on the expense report that I wanted to highlight for you. Salary and benefits are on track, except under the temporary seasonal staff, and of course, that's due to COVID. We hired a lot of staff, and we still have some on. Dropping down to the operating budget, four of them I wanna highlight there. UC North Dakota Cares, that's actually Ryan White, and for some reason, I can't seem to get it updated on the spreadsheet, but I did it in the office today, so the next time you see it, it should actually say Ryan White. Anyway, we had budgeted 80,000. We received quite a big additional amendment to that contract because Cass County has the largest caseload in the state. And if you, just to remind you, Ryan White assists North Dakota residents living with HIV or AIDS to access health and support services. So we have an RN who works with them and helps get their bills paid. We also get a percentage of that as revenue. So we budgeted 80,000, but through September, we've had 203,000 spent. Revenue as of August is 250,000. By the end of the year, I'm sure that's gonna be 300,000. The next one down is marketing, and that expense of 520,000 is all covered by the COVID funds, and that was the marketing campaign that's still ongoing. The next one down I will point to is the other services, because that's pretty high on this budget. That is due to the harm reduction program and mostly taxi rides. The other things in that are just simple services we have at the buildings they have. And then custodial, that is up, and we budgeted 12,000, we're already at 26,000. And again, that is for the Downtown Engagement Center, all their utilities and all of their cleaning for the building, even though there's multiple entities in that building, is all coming to Fargo-Cass Public Health. The other things, everything else pretty much on this budget that is over budget is due to harm reduction or COVID. The last one is in-state travel that I'll point out. That is mostly the hotel bills we paid. Most of the harm reduction costs and the COVID costs were all covered by grants we had. So those expenses are pretty much taken care of. Anybody have any questions on the expenses?
Melissa, on the building rent, do we pay the city
No,
rent?
that was again COVID. It was for renting when we were paying for the the 25th Street test site.
Gotcha.
And I'm sure there's other things in there, but that's the majority of that. Any other questions on that side? Okay, I'll move over to the revenue side, and just a couple things I'm gonna point out is, again, up in the grants area, the budget numbers they're way off, I would say, not just a little off, they're way off. We have quite a few things that didn't get budget adjustments for the year. Some of them came in after the budget was approved last year, and with all the changes in finance, some of those we just decided not to do. We didn't know what was gonna be happening, how much of those grants we were actually going to spend, so we didn't put them in the budget. Some of the line items are just in the wrong line, because the grant ended and it got mixed up, but the revenue is all there, so that's coming in quite well. I don't think we're gonna have any issues with meeting our budget at the end of the year, even if the budget numbers were correct. The other two things I want to point out is under self-pay and under Medicaid. So Medicaid expansion, we had been putting into the line item of third-party insurance, but as the audit process went through this year, we realized that Medicaid expansion is really should be slated as Medicaid. When we had a Medicaid expansion originally, there was lots of back and forth of that, and so we had kind of left it in our insurance line. Now it has gotten moved to the Medicaid line items, so those are going to be up this year quite a bit, and our third-party insurance number is already way over budget, and that had to do with COVID vaccines that we were billing. So that wraps up both of those sheets. Do you have any questions on the revenue?
Any questions?
Good, thank you.
Okay. All right, update on the strategic plan.
Hi, everyone. And I just want to give Melissa a shout out because the number of grants that she has had to manage through COVID and all of this has been astronomical, and trying to figure out the funding and the reporting and all of that has been really challenging. So well done. But I just want to really quickly talk a little bit about our strategic planning process that we are kind of in phase 2 of. But you should in your packets have a copy of where we're at kind of at this point. So when I started in this role in 2018, you know, there was a lot that I had personally that I wanted to do to engage staff and to work on, you know, kind of us as an agency working together more, things like that. And then there was COVID. So we were really good starting our efforts in 2018, and really everything got put on hold in 2019 and has been to that point. So even in 2018, strategic planning was something that was really important to me at the staff level. So I've been at public health almost 31 years, but I remember 15, 20 years ago, we did some kind of strategic planning process, but no one can really find a document that supports that. So granted, there probably was no follow through, and that was one of the, you know, obviously strategic planning can't work if there isn't accountability and follow through. So we're hoping that this process is going to be much better. I think staff are excited at the possibility of new things to come. So we want something that kind of helps us, you know, provides that roadmap of where we want to go as an agency and what are our priority areas and what activities do we want to do to get there. So those are, that's kind of where we're at right now in the process, is kind of coming up, you know, with those activities that support the goals and objectives that you have in front of you. And really, you know, this is important just because it does help us as a group have a common goal, right? So the last 3 years have been really hard on staff. There's a high level of burnout. There's a high level of, you know, kind of hopelessness sometimes. And I think providing that, okay, this is why we're here. This hasn't been easy for everybody. It hasn't been easy, you know, public scrutiny, whatever. It has been very hard on staff. Trying to defend public health has been challenging. But this is going to help us, you know, hopefully develop some resiliency so that we can continue to do the good efforts that we know we can do. The other thing is that accountability piece. So we are having an oversight capacity for this strategic plan that's going to involve everybody. And I think, of course, when you are accountable and you have it out there as to what the expectations are, everybody is aware of that. And when you monitor and follow up on that, you know, then you have some latitude to hold each other accountable as well. And so I think that will be a really strong suit for us going forward. And again, every one of us. So when we talked in our all staff meetings, you know, this isn't about me. This is about, you know, what each of us can bring to the table, and it can involve everybody. Everybody in our agency has a role in if this will be successful or not. So that's really how we're approaching it. And it was really my, you know, sight for this was to have staff have that input so that they would feel ownership and have that sense of control going forward. And also if we can get everybody, you know, working together, we have that really, you know, that road towards being a high-performance workplace, and that's really what we're striving for to get things accomplished. I did show this graphic at the all-staff meeting just to show, before we were really functioning as the bottom arrow, right? So everybody was doing really good things independently. So each division had their roles and they were all doing well, but we didn't have really this force going in one direction. So what this is going to do, giving us an agency perspective, is to help us kind of get everyone flowing in the same direction. And this will also give us latitude to have divisional plans that will actually feed into our larger agency goals. And so people are excited about, working together and, having a greater impact as one. So I think that will be really cool going forward. Just to give you a little idea of where we've come from. So we did hire public health consultants for this. It was really important for me as the last strategic planning. I think we did kind of came from a business platform and didn't really feel like it was a good fit for us. And so the beauty of having public health consultants was they know where we've been. They know the struggles we've had. They know the climate right now, and they could, talk with staff and address like, where do we go from here? And, this is what the nation is dealing with as public health. Everyone is struggling with infrastructure and different things, and it was really nice to have that perspective brought in. So we had planning meetings with them virtually for quite a while, started in March of 2022. We had, they gave us some tools to use. We had division meetings where we, one was called Windows into Our World, and the other was a SOAR document where we explored our strengths and our opportunities and challenges, different things like that. And we got input from all staff, so we would see what those responses were. They worked with our leadership team on site so that we could work on cohesion and what's the best way going forward, knowing that our leadership team has to strongly engage in this for it to be successful as well. We then had an on-site strategic planning day that involved the leadership team and about 15 staff members, where we had a full day of kind of working through like what are our priorities, what's our values, how are we, how do we move forward? And so then that's what came out of all of those efforts is that the document that you have in front of you. That came to me about the middle of August, and we sent that out again to all staff to get feedback, to say like, did we get it right? Is this where we want, and gathered that feedback. And just know that the consultants, when they took the staff comments, they kind of formulated themes. And so that's really what the goals are. And so as we develop the activities, those will be more specific to activities that staff can really quantify and make it more detailed. So what we came up with for value statements or values for Fargo Cass Public Health that were our priorities were communication, trust, accountability, compassion, and empathy. And our strategic areas are communication, collaboration, workforce, policy, and infrastructure. Those are in no specific order, although I will say communication after the pandemic really was the number one thing for everybody because it got so siloed during the pandemic. So our plan with this, obviously when we set out to make the goals and objectives, our main focus for the first year is going to be on internal functions because we need it. We need to support our staff right now. We need to help each other be resilient and be supportive of each other and develop those really intricate things internally before we can, focus that force externally. So that is kind of how this is going to be built. And then you can see specifically under each of those strategic areas, we have the goals and objectives listed. And so those are where we're at right now, where we are going to start then building out those specific activities that will support those goals and objectives. We are hoping by the end of December that we have our activities kind of shored up. We did look at all the staff responses, and from all of the worksheets, the strategic planning day, any staff feedbacks, and we took all of the actionable items out of those that we will be using as our activities, and then we will kind of fill in gaps from there. So if that's done the end of December, we're hoping for a January 1 implementation date to start with those internal activities. As far as an evaluation component, we kind of solicited volunteers from the staff. So we have 2 staff that will be assigned to each goal, and they will be those people that go and reach out to those doing the activities and seeing where they are, do they need more resources, and have discussions with them, and then they will bring that back to management team and see if there's any adjusting that we need to do, and we will just report out to all staff so everybody is in the loop on things. And then again, I talked about, divisional plans. We're certainly encouraging divisional level things too, as those might get more program specific, but the goal of that would be to feed into our overall agency goals as well. So, and then I was just going to have Justin speak a little bit as to how our strategic plan kind of interfaces with all of the other plans that we have. Justin obviously oversees the agency plans, everything except the emergency preparedness plans that we have.
Hello. Our strategic planning really set forth a foundation that we're going to be able to build on. So as we go forward with a health assessment and improvement plan, we can link back some of those strategic goals into these other areas. One that was really discussed in our strategic planning meetings was quality improvement. There's a lot of opportunity to do that. So as we move in, there's ideas from infrastructure that we can use, policy that we can use, collaboration that we can use. And again, if we're focusing on internal, there are processes that we can foundationally build on and then find improvement if we're doing continuous quality improvement. So the strategic planning really is going to be that foundation that we have everything move forward from. So.
Madam Chair, if I could ask a question here. So when I look at this, a couple of these are generated from the community. Mm-hmm. And I certainly appreciated the assessment data that was in this report. Wow, the priorities that had been identified. Mm-hmm. Some of these sound like they might be internal plans. Are they fiscal review, community engagement? Are they more internally generated plans?
They're going to be, communication plans, they are going to be internal, but then focused on the external. So there are going to be opportunities for partnerships and those types of things. Fiscal review, again, as a government agency, there's going to be those parts that we're just always going to be involved in and transparent with. So we will be able to bring a lot more information to you in a bit of a package that will be easier to go through. Community engagement review and plan, again, as we do the internal processes, there's going to be opportunities for us to link more with external partners. So how we get to those areas are going to be that quality improvement, right? And what processes are needed and who should be involved in these conversations. So yes, there's going to be a lot of internal that is going to be needed, but there's also want to be much more transparent in using our website for communication and putting the plans out and people reviewing. So fiscal review and plan, we've seen different drafts of what they look like, but we've never done one before. So there's going to be a learning process for us in that whole way too.
If I could just do a follow-up. So it sounds to me like you will be pulling in perhaps, the workforce development.
Yes.
I'm assuming HR would be involved with that?
Or
not?
There's opportunities for, and again, that's going to be part of the internal process. So with leadership, that will determine what are our needs, where have we, have opportunities that we haven't used before. So an example could be we need to do more recruiting. So there may be opportunities then for working with HR to develop something or involved in the communication. And again, with Chip, when you attended the stakeholders, that is going to be an opportunity. Okay, where more people from external should be involved in too. So a lot of it is kind of going to be new for us, which is exciting because, sometimes change. We're going to find opportunities to do things better. And there's going to be times that, okay, well, we haven't done this better, but we can adjust.
If I can make one final statement.
Sure.
I see, Justin and Desi, that this is a great opportunity to bring the externally identified priorities to the internal operations and how your internal operations support those priorities or interact with them. So that's what I'll be interested in seeing.
Good. Yeah. It's foundationally, there's going to be these 5 goals that will really build out where we move forward for the next couple of years.
You started going where I was going to go with the community health needs assessment in particular. Maybe just if you could dive just a little bit deeper on how those two intersect, because I think that's the community telling you what their concerns are, and so if we can just expand on that a little bit.
On just the health needs assessment? Okay, so we had a process that we attempted with our health partners. We always work with Sanford and Essentia and Clay County and other partners. This last year was really tough. We did it during 2021. We were in a bit of a lull between one of the waves that we had. And it's always going to be challenging to get a accurate sampling from the community. Historically, we've had an overrepresentation of highly educated, higher income white women. So we know that we're missing segments of the population. How to gather that is going to be a challenge, and that's, less people have landlines, so we're not using the phone calls as much. So how we do that is going to be a goal of ours. I set forth a data request from the North Dakota Department of Health for, it's BRFIS is what we always refer to it as. It's behavioral risk surveillance. Oh my goodness, how is it? So the CDC requires, do you remember what BRFIS stands for? The full thing? Behavioral risk surveillance system. Survey, thank you. So the state of North Dakota, as part of the surveillance system, they are required by CDC to do this. So one of the issues that we've had in the past with data is we've always looked at county as a whole, which is great. You look at a painting, but you don't see the brushstrokes. So where in the stratified data are we finding out who we're communicating to, who we're missing, where representation is high, what risk categories before they get to those points. So if we work on, say, a communication plan, we can identify that, teens or preteens are the one we need to really focus on before vaping becomes a larger issue. So communication plan towards that. Again, micro plans, macro plans it's going to develop. So state has been working to update a dashboard and create something that we're going to be able to use going forward that would be more sustaining than just like the one-time report. Haven't gotten there yet, still waiting on that. But we didn't get representation in the 2021 survey that we would have liked as much. And then different data, because again, where we've seen the economy go in the last 2-3 years has been up and down and up and down. So some of the data we get as we would publish it would be out of date right away. So that's where we're kind of at. I've been holding off on the health assessment from the strategic planning point, but also to get the data from state for BRFIS data where we can break it down a little bit deeper. So it's something we really want, and it's something we really want to build on. And again, now that we have our strategic plan, it's going to be published, it's going to be ready to go, then we can start to build that. And there's other parts too where, say, policy, infrastructure, collaboration, we're going to have opportunity to link that with the health assessment. So we need more collaboration during our health assessment process. We need more feedback from what is the infrastructure that's required to do some of those things. Those are parts that we can build on the plan.
Thank you, Justin. Other questions?
I do. Is it on? I think so.
Yes, it is. No, it isn't. Now
Now
it
it
is
is.
now.
Every time I push this thing, it doesn't work. So I love this plan, the strategy plan about public health as always. My biggest advocacy, so it's good. My question is for you, how do you diversify? As you mentioned here, it's one of your strategy plan, number one for communication. And you know that especially like the city of Fargo, is very diverse communities. And we have so many stakeholders out there. We have so many organizations that are representing the community. Have you discussed with them regarding this strategic plan, the strategy plan that you have here, or just to have an input from some of those diversity communities?
Right.
Especially if you have like MPH or doctor that are working in a hospital, maybe at Sanford. Have you tried to even like talk to them about certain thing like this? Just to give you, for them to give you input, on some of the.
Right. Actually, we have a health equity grant that we're working with right now that we've really made. So I'll say a lot of partners that we've had have people that were in these organizations have moved, have left. 2020 really shook things up. So we're still settling out, like even developing a stakeholders list of who the contacts are has been a bit of a undertaking at this point. But with the health equity grant, we've had an opportunity to work more and identify partnerships and who's being left out and who we're talking with. There's a couple people from the state right now. We have a listening session with New Americans on October 20th. We're going to be doing some feedback, attitudes, behaviors around whether it's COVID vaccine, whether it's health in general. Again, we don't know who we're not missing, right? So there's been this part where we right now really want to build some partnerships back up and find out, okay, who haven't we been talking to? Who have we been talking to? And sharing that with the group, because we haven't always done the best job of connecting with some different representative groups. And I think it's always going to be a challenge when we are stretched a little thin at times. And I think coming out of COVID, losing touch with who those partners are has been a challenge. Even for the health assessment, when we were trying to do our stakeholders plan, I tried to call 3 different numbers that I had for people from the New American Consortium, and they were old numbers. So I ended up talking to someone in planning, and they had an updated number for someone. So there's been these parts that we've just lost touch with different organizations, and now we want to focus back on it.
Well, thank you. And I think that is not only New American, to other people as well, like Native Americans,
Right.
African American. I'm not just only talking about New American. I'm talking about in general all the diverse background.
Yes.
Because that's where you will get all your data that you need.
Right.
Because the New American community, of course, will get in contact with you no matter what.
Right.
So yeah.
I can get you some more feedback on different planning sessions and health equity stuff that we've been working on that would help.
I would appreciate it. Thank you.
Absolutely.
The tone of most of the questions is that you're working on this on an internal basis, first. When does that intersect with the community engagement? Commissioner Preston's question, Madam Chairman's question, the lady's question, all is around when does that intersect, that all of those stakeholders in the community have some insight or input as well. And I realize, a strategic plan is built from the inside out, but there has to be an intersection of, to really get the community engagement. And as you've said so adequately, is that there's been a loss of that connectivity because of what we've dealt with COVID. And that's going to be absolutely instrumental to get that back. This is like management from the top down, and at some point, you have to get the rank and file engaged, and that's our community stockholders. Thank you.
Yeah, and I think, those type of activities they happen all the time, and they continue to happen now. Like you said, we're trying to build up some partnerships and establish some new ones. But I think, this strategic plan obviously doesn't take away anything else that we do. So we still have our existing collaborations and things like that. But I think if we can get about 6 months into our internal plan, and then we can start focusing on building those activities for the external, and that's where we would be seeking input on how, best that would work to engage our community partners. I'm guessing, I know that the community health assessment has been lagging because of the other duties that we've had, but once we get that data and can put that out and release some of those things that we have, and then there's other community things that are developing as well as in the wellness activities, things like that that are kind of potential new partnerships going on. And so those will all happen, but I think if you can give us 6 months into this plan to get some of our internal stuff established, I think then we can do better reaches for external.
On all the boards that I serve on, one of the main questions that we always ask is how short-staffed are you? Do you have a number?
I don't know that. Probably our biggest challenging area is harm reduction. And I think because of the great success that like the mobile outreach team has had and the impacts, so there's, everybody wants more of that, which is great, but in order to do that, then that, becomes logistics of funding. And I think there's funding for that, but right now for Jan and her group, it's finding people to work. And I think even with some of our nursing positions, there is, when we put an ad out, there is not a overwhelming response at this point. So I think that's really going to be the challenge of, growing. And when you grow, then where do you find the people? So I think we have to keep that in mind when we're planning to make sure that if we structure something that we actually have the bodies to bring that in. But I mean, right now, I think we are covering what we need to cover. It's just getting back. I mean, people are, now that things are picking up again and staff numbers are coming back for our programs, people are just kind of feeling that a little bit. And there's certain roles, like the state is still taking on that COVID testing site, and I know they had asked Doug if we wanted that back in January, and we're like, no, we can't take that on from a staff perspective. So there are things that we have to kind of pick and choose, knowing what our limitations are. But I think from this point, we're meeting the basics of what we are doing. Could we do better with more staff and different things? Sure, we could. I think the challenge would be finding, and for sure we need to support, I think, that mobile outreach team and housing supports, things like that, where we know we're making a really pretty significant impact at this point.
Just a comment on the community involvement piece with your strategic plan, and this is just a comment, excuse me, but beginning January 1st, CMS will start requiring participating organizations to assess and address social determinants of health. Formerly, or the social, they've changed the terminology now from social determinants of health, but of the organization's patients. And so that will be a requirement or a regulation for organizations. So perhaps there will be opportunity for collaboration with our community healthcare provider organizations to further, that's just another pool of data that we would to hopefully utilize as a community. Public health-related social needs instead of social determinants of health, that's the new term.
Yeah, if we could have a steady stream to data, that would be like super helpful. And there's things internally we need to do as well. We need to look at in our electronic system, we have to look at our client base that's coming and where are the gaps and what demographic are we serving and where are we missing out. So that's stuff we have to do internally as well, that hopefully now that our response patterns are changing, we will have time to put more efforts into that.
Quick question, sorry. Maybe this question has already been asked. How do you get your data? How do you said, is it through internals or?
Well, for like a health assessment that we're doing?
Yeah, for,
So with the health systems, we partner to do we what did he call it last time? Community Health Needs Collaborative for Fargo-Moorhead, really catchy name. So we tried to develop surveys, and before it was, oh my gosh, it was like a 6-7 page, like it was tough to get through the survey. And then we would send that out. I think we hired NDSU to do some polling before and stuff too, surveys where we would call. This last time, we really, are you familiar with the County Health Rankings, University of Wisconsin? They have a really fancy, nice webpage that's great. We modeled our survey more after that to make it hopefully more functional going forward. Plus we can see and gauge changes a little bit easier if we're also using County Health Rankings for some of it. That's become the new model that we're doing for the health assessment. And we do that every 3 years with the hospital systems. As far as other data, I'm pretty good at finding things online and scraping a little bit, trying to see what's out there. I think that's why I really wanted state with the BRFIS data that we can really develop and get a little bit more of stratified data rather than just looking at heart disease in men in general. Like, at what ages are we seeing the precursors, and are they happening earlier? Are they happening later? Getting some of that information a little bit more broken down so we can develop communication plans, or we can really target efforts a little bit more efficiently. That's kind of where we're trying to get to.
well, thank you. I do have more questions, but I guess the time is going down. And because I do understand, the survey questions, sometimes they can only go to specific people, but it doesn't get to everybody.
Right.
So technically, you probably might not have all the detail that you want on a survey on information. But other than that, I will let it be. Thank you.
Thanks.
Thank you, Justin. Thanks, Desi, for the update on the strategic plan. Next on the agenda is the substance use coordinator update. I think Robin's going to provide that. And Robin, you're welcome to come back to the next meeting if 5 minutes isn't enough time to fly through your slides.
It's that. No, I don't.
Substance abuse.
Oh, you go. Okay.
Good afternoon, Madam Chair and board members. I had two parts to this presentation. I'm going to skip past the first part and just get to the meat and potatoes since we're short on time. I wanted to provide an update on our state opioid response grant. We just ended our fiscal year for that, which runs from October 2021 through September of 2022. And here are the program areas that grant addressed: the Parents Lead program promotion, the Speak Volumes campaign, access to prescription opioids, opioid overdose prevention, reducing barriers to treatment, anti-stigma campaign, syringe services program, and the ONE program. So for Parents Lead program promotion, that is a program through the Behavioral Health Division, and it is a prevention program aimed at parents and professionals. And to promote that program, we did 121 social media posts and reached over 20,000 individuals. We participated in 2 booths, a news conference, and distributed over 1,000 promotional materials. The Speak Volumes campaign is another campaign through the Behavioral Health Division at the state of North Dakota, and that campaign ran January 2022 through September 2022. We did 72 posts and over 26,000 people were reached. That campaign is for adult binge drinking prevention, and it's really hones in on drink size and educating individuals on that information. Access to prescription opioids is a effort to reduce access to prescription opioids. We did 67 social media posts on that, reached over 12,000 people. We did 2 booths, and we distributed 710 Deterra bags. There's a picture of those there. Those are for bags that are used for medication disposal if someone is unable to go to a take-back location. For Overdose, we did 130 posts, reached over 55,000 people. We were featured in over 13 news stories and a City of Fargo video, and we had a lot of activities for International Overdose Awareness Day on August 31st. That is a picture of the mural that we have for that event on our Harm Reduction Center. That mural was painted last year. This year, the artist came back and added names and initials of individuals that died as a result of overdose into the butterflies. You can see there at the bottom. We had family members request 52 names be added to that mural this year. For opioid overdose response, we did training and Narcan distribution. We did 63 trainings, trained over 700 people. We distributed almost 4,000 naloxone kits, which have 2 doses per kit. We had a report of over 1,000 doses that were administered and a report of 553 reported reversals. That means that 553 times in that year, a life was saved as a result of Narcan that we distributed through Fargo Cass Public Health. We distributed 770 fentanyl testing strips. That was just June through September. Those are the only months that we were required to report that information, so that's why I just have those few months there. And for the Narcan Leave Behind program, that is a program where Narcan is left behind at opioid overdose calls. Fargo and West Fargo fire departments are participating in that program. You see there a picture of the sticker that is put on a Narcan box where individuals can scan a QR code to watch the training video, request more Narcan, find treatment options, and other resources. Our syringe services program, that is a disease prevention program that directs individuals to treatment and provides testing. We did 136 social media posts, reached over 35,000 people. We gave 9 presentations to 233 individuals. At that program, we served almost 1,000 unique individuals, and we had 368 new enrollees. And we were also awarded a AIDS United COVID-19 grant for $100,000. Transportation to treatment, part of the grant is to reduce barriers to individuals trying to seek treatment for substance use disorder. That is a look at all of the individuals by month that were provided rides to treatment that did not have transportation. Here's some samplings from our anti-stigma campaign. The anti-stigma campaign was to try to reduce or lower the amount of stigma in our communication. Stigma for people that have substance use disorder or stigma against substance use disorders in general is often cited, or it's been proven actually that people that are subjected to stigma do not seek treatment or or ask for help. We did 58 posts and almost 14,000 people were reached. And then the ONE program, which stands for Opioid and Naloxone Education, our home health nurses screened patients with an opioid prescription and provided education, resources, and support to ensure safe use. That program was in operation April through September. We screened 180 clients. 16 medication lockboxes were provided, 36 medication disposal Deterra bags were provided, and 6 patients received education as well as Narcan for overdose prevention. I'll take any questions.
I don't know how you just did that. That's a lot of information to go through, and I definitely would like you to come back and expand on those programs, because this is where public health is, you're truly making a difference in the lives of individuals, and so we definitely need some more information on that, and just tons of good work that you're doing in the community.
Thank you. Thank you for your support. Much appreciated.
Of course. All right. Do you have anybody for public comment? No. Okay. Next meeting is December 16th.
Lori, you had asked us to do a verbal roll call, which we did not do at the beginning. Would you like us to do that now?
Right.
I have the names pulled up. Okay. Chelsea Matter,
Here.
Kayla Nelson,
Here.
Amy Lavala,
Here.
Naim Alday,
Here.
Arlette Preston,
Here.
Bernie Dardis, Dwayne Breitling,
Here.
Charlene Nelson. Here. Lynn Telford, here.
Madam Chair, if I could also make just one quick announcement. Have to bring forward the fact that Desi was awarded a recognition from the North Dakota Medical Association for being a friend of medicine, and it's related to all the work that you, as well as the staff around you, did on COVID. So just one congratulations.
Okay. Well, we'll see you all December 16th. Remember to bring your socks to Gladys Rave, so folks have socks. And happy Socktober.
I read through the materials.